Hi guys, welcome back to a new video. If you're new to my channel, my name is Busola. I'm a final year medical student living in Nigeria. I make medical school and lifestyle videos. If you've not subscribed, please hit that subscribe button right now and check out all my other videos. I have a lot of videos that you'll find interesting. So in today's video, like the title says, I'm going to be doing a medical school breakdown, a breakdown of medical school in Nigeria to be precise. And the reason why I'm doing this video today is because I've gotten a few questions around this topic. Like, people ask me different things around how medical school works and what you do when. So I decided to do this video to pretty much break it down for people who are just curious and also people who are looking to go into medical school and they just want to know what the journey is like. So without further ado, let's jump straight into the video. Before I continue, I would like to put a disclaimer out here to say that not every medical school in Nigeria is the same. Every medical school has their own slight differences here and there, but for the most part it's the same system, like it's the same idea. So even if the way your medical school works or the way the medical school you are looking to go into works a little bit differently, the idea is still pretty much the same. So in this video, I'm going to be breaking it down based on how medical school goes in my own school. So if you have slight differences in your own school, if you're already in medical school and you have slight differences in your own school, please do let us know in the comment section below so that people can learn from it as well. Medical school in Nigeria generally takes a whole duration of 6 years in total. Now, ideally, you're supposed to spend 6 years in medical school, ideally. But you know, we're in Nigeria and things are hardly ever ideal in Nigeria. Things go crazy in Nigeria. So a lot of the time, we actually spend a lot more than 6 years in medical school. For people who did not even repeat or have any issues, you spend most of the time, especially if you are in a public university, a federal university, you tend to spend close to 7 years, depending on whatever happens while you are in school, depending on whatever predicament the country decides to rain on you while you are in school. In Nigerian universities, each year you are in is called a level. So we have 100 level for first year, 200 level for second year, and so and so and so. So pretty much in medical school you have 100 level to 600 level and then you're done. So to break it down very broadly, medical school is divided into pre-college and college years. You have just one pre-college year, and that is 100 level. That is your first year where you are not in the college at all. The courses you are taking are not medical school related in any way. And then we have the college years where you actually enter into the College of Medicine proper, and now you're a part of the college. Now you are doing medical school courses. Now, to further break it down, we have preclinicals and clinicals as well in college years. So between 200 and 600 level, you have your preclinical and your clinical years. Your preclinical years are your second and your third year, while your clinical years are your fourth, fifth, and sixth year. And the reason why it's called preclinicals and clinicals is pretty much because in your clinicals, you are actually doing clinical work. You are doing the work that doctors do pretty much. So it's like you are a proper apprentice now. You are actually doing the practical aspect of it. You are not dealing theoretically anymore. You are actually interacting with clinical patients, real life patients, real life cases. So that's pretty much why it's called clinical years. Preclinical years, you are pretty much preparing for your clinical years. You are getting the knowledge, the foundation for what you're supposed to know in your clinical years. So I'm just going to break down each year into the courses you are actually going to be doing in each year and what sort of exams that you should expect in each year. So in your first year, I like to call it advanced secondary school. It's sort of like kind of like A-level stuff, like secondary school work but on steroids. The courses you take are English, botany, zoology, chemistry, and physics. So you take all those courses and then you take the practical of each of those courses as well. You have 2 semesters in first year, the first semester and then the second semester, and you write a test and an exam in each semester. In the middle of the semester you write your test, and at the end of the semester you write an exam. In medical school you have to pass your first year. If you don't pass every course in your first year, you cannot move on to your second year. It's not like every other student in university where even if you fail a course, you get to carry over that course. So you are moving on to the next class, but you have an outstanding course that you have to pass before you finish your time in university. So it's not like that. You have to pass each year. There's no such thing as carryover. You are not carrying anything over, boo. You are not carrying anything over. You have to pass each course in each year before you move on. The pass mark in 100 level is 40%, so you just have to make sure you don't have an F. If you fail a course, you are going to have to stay back the entire next year to pass that course. You are not moving on until you pass that course. So now moving to college proper. From your 2nd to your 6th year, you don't have semesters anymore. So you don't have semester breaks. There's no such thing as first semester, second semester. It's just a stretch of year, like the entire year at a stretch like that. If you are coming to school, just know that you are not leaving until the end of that session, except if there are public holidays in between and they are kind enough to let you go. But apart from that, it is the stretch of 1 year. You don't have semester breaks like every other person in university does. You pretty much just do the entire year at a stretch. In your preclinical years, your 2nd and your 3rd year, you do 3 major courses: anatomy, biochemistry, and physiology. So in anatomy, you pretty much learn the structure of the human body from your head to your toe, and it is divided into different parts. So in 200 level, you learn about the upper limb, the lower limb, the thorax, and the abdomen. In 300 level, in 3rd year, you learn about the head, the neck, the pelvis, and the perineum. For physiology, you pretty much learn how each organ in the body works. So anatomy, you are learning the structure, what is in where, what passes through where. But for physiology, you are learning how these things work, what makes them work, how they work. You learn the mechanisms of these things, like the intricacies of how they work. And then for biochemistry, you pretty much learn the chemical processes of every part of the body, what goes on chemically in every part of the body. You learn that in biochemistry. For each of these courses, you also do practicals. For anatomy, you pretty much work with cadavers, you dissect cadavers, and you get to visualize how the human body looks like. For biochemistry, you work with chemicals, and for physiology, you work with instruments, and sometimes you get to practice on one another as well. For each course, you do 2 in-courses and a final exam, and that final exam is called MB. That's the medical board exams. So you do 2 in-courses. Those are like tests pretty much, and those 2 in-courses account for 40% of the entire 100 marks in each course. So your first in-course accounts for 20%, your second in-course accounts for 20%, and your final MB exams accounts for 60%. So now moving to 4th year, like I said, from 4th year you are in your clinical years already. In 4th year, I feel like 4th year is generally the longest session in medical school. It is a lot, actually. I feel like my 4th year traumatized me. I feel like I've said it a couple of times on this channel as well. I feel like my 4th year traumatized me. It was a lot of work. We had a lot of workload. We had a lot of courses to do. It's usually more than 12 months, and personally I just feel like it's a very, very stressful year. So the courses you do in 4th year are divided into 3 broad sections. So you have pathology, pharmacology, and introductory rotations to 600 level courses. I'm going to explain that in a moment. For pathology, you pretty much learn about disease processes in human body. So every kind of disease that can happen to human beings, you learn about those in pathology. So it's divided into 5 courses. You have the morbid anatomy, you have hematology, immunology, chemical pathology, and microbiology and parasitology. So that makes 5 broad courses that you are doing. So for each of these courses, you do practicals for each of them as well. Now moving to pharmacology. Pharmacology is just one broad course actually. In pharmacology, you learn about every single drug that work for all the pathologies in every single system. You learn about those in pharmacology. So pharmacology is pretty much drugs that work for the cardiovascular system, for the renal system, for the central nervous system, for the gastrointestinal system, every single system. And you also do practicals for pharmacology as well, where you actually enjoyed my pharmacology practical. Worked with rats, with rabbits, and we were injecting them a lot and just seeing the effects of these drugs displayed on these animals. So that was very fun. And then lastly, you do introductory rotations for 600 level or for 6th year courses. And 6th year courses are pretty much medicine, surgery, and community health. So you do introductory rotations for this, I think 1 month each. So you do a month's rotation for medicine, a month's rotation for surgery, and a month's rotation for community health. And you do this in the hospital. So here you actually go to the hospital and you do these introductory rotations. Pretty much, I think the idea for that pretty much is that when you get to 5th year and 6th year, where you're actually interacting with real life actual patients, you are not completely confused like what is going on here. So it is in these courses that you get to learn how to collect patients, how to examine patients as well. Now for the exams in 4th year, you pretty much do a test and an exam, a major exam. So at the end of each posting, so now you are doing posting, you're not really doing classes anymore. We don't call them classes anymore, we call them postings. And at the end of each posting, you write end of posting exams. That's what we call them. We call them EOP, end of posting exams. And they are pretty much tests. They carry 40% of your entire 100 marks. And then at the end of the session, you write your final MB exams for each course. So now moving to 5th year, which is my favorite year in medical school. And the reason why is because I feel like 5th year is the most structured year in medical school. You guys, I love structure. I love to, focus on one thing and do that thing. Like I don't like to be confused, and 5th year gives you that a lot. Now in 5th year, you have 4 major courses and 2 minor courses, which are called subspecialties. So in 5th year, we call our courses specialties actually. So you have 4 specialties and the minor courses are called subspecialties. So 2 subspecialties. Let me address the subspecialties first. It's very confusing, to be honest, but the subspecialties are a part of 6th year courses, a part of surgery courses, and they are radiology and anesthesiology. So you do these postings in 5th year, but the exam that you write, the test that you write at the end of this posting in 5th year, it doesn't reflect on 5th year, it reflects on 6th year. So even though you do the posting in 5th year, you write the test in 5th year, it doesn't affect your 5th year, it affects your 6th year. You have obstetrics and gynecology, pediatrics, dermatology, and psychiatry. Those are the 4 major courses you do in 5th year, and you are pretty much divided into small groups. So in fact, from 400 level, from 4th year, you guys are not doing courses as a whole class anymore. You probably will not attend any class together. You will probably not even see. There are a lot of my classmates that I only see on exam day, during final exams at the end of the session, because we are in different groups. So there's nothing that we have to do together except for when everybody comes together at the end of the session to write exams. So you're divided into small groups and you pretty much rotate these departments. At the beginning of each of these rotations, I think for 2 weeks or a week, you are pretty much sitting down in a class just receiving block lectures. We call it block lectures. It's lectures back to back to back. So from like 7 a.m. till like 5-6 p.m. it's just lectures. Your consultants will just be coming in and going out and be giving you lectures back to back to back for those 2 weeks. And then after those 2 weeks, you move to the hospital and you are plainly just doing rotations. You are plainly just shadowing your doctors and learning things firsthand. I absolutely love this, you guys. It is very, very practical, and I love the practical aspects of medicine. So I had such a blast in 5th year because of that. It's very, very practical, very, very hands-on. The things that you are learning, you are seeing them as you are learning them. Like the things that you learned during block lectures, when you go to the hospital and you are doing your rotations, you are seeing them firsthand. And then another thing that is interesting about 5th year is that you start doing call. You actually go on call, you do overnight calls, and sometimes you actually don't get any sleep. So that is also very interesting. At the end of each rotation, you do end of posting exams also for each rotation, and also again that carries 40% of your entire 100 marks. Now moving to 600 level, 6th and final year in medical school, you are pretty much doing 3 major courses. Pretty much that's what you are doing. You are doing medicine, you are doing surgery, and you are doing community health. So again, at the beginning of each of these postings, you do block lectures where you just sit in class and you receive lectures throughout, and then for the rest of the posting, you are pretty much just shadowing doctors and doing hands-on practical stuff. At the end of each posting, at the end of each rotation, you write your end of posting exams, which are like pretty much like tests. They carry 40% of your 100 marks, and then at the end of the session, you come together, everybody comes together, and you write your final MB exams, your final exams in medical school. And once you pass that, you're a doctor. It's as simple as that, you know, easy peasy. So that's pretty much how medical school goes. It is actually quite complicated. Like, the way each year works is very different. In fact, the way each rotation, each posting, each course works, very different, and it can actually be quite confusing. I actually did not know all of these before I entered medical school. In fact, like, even when I was in pre-clinicals, I didn't really know how clinicals really works like that. I just knew that yes, you will now be doing practical stuff, like actual hands-on stuff, and you'll be working with patients. I actually did not know all the things that it entailed. We've come to the end of this video. I'm not even going to lie, this was a very hard video to make because, like I said, very complicated. There are actually some things that I left out because if I should actually go in depth into the intricacies of how this thing works, this video will probably be too long, and I don't want that actually. And I feel like this video gives the basic idea that any layman actually really needs. Like I said, if I left anything out or if it is done differently in your school, please let me know in the comment section below. If you've not subscribed, please hit that subscribe button. I don't know why you've not hit the subscribe button yet, but please hit the subscribe button and please like this video. Thank you so much for watching. You already know the drill. Don't forget to be kind to yourself and be kind to others. I'll see you in my next one. Bye.